We're looking at this week's health headlines, including some surprising information about women and motherhood. Our Morning News medical contributor and Northwestern Medicine physician, Dr. Lauren Streicher, joins us now. Good morning.
Good morning.
Good morning.
So more women opting out of having children.
Yeah, this was really interesting because since 2007, the nation's birth rate has been steadily declining by about 2% a year on average. But last year, a huge drop, the biggest one in 20 years. Births fell by 4%. So the CDC said, we got to look and see why this is happening. And, no surprise, it was a pandemic year. Maybe a pandemic is not the best time to get pregnant or to have a baby. A lot of economic insecurity. People talked about that a lot, political insecurity. But the other thing is that there's a lot less stigma about a decision not to have kids. Think about it. It's always been, if you get married, there's this societal expectation that you're going to have a baby. And a lot of people really just don't want personal choice, and they're not getting as much flack about that. So a lot of people are just saying, no, you know what, not going to have a kid. The other thing also that the CDC didn't talk about, but in my literature is really clear, is because of the Affordable Care Act, because of Obamacare, women have greater access to reliable contraception, which means not only less abortions, but also less unintended pregnancies. So it'll be interesting to see if this continues. The other thing that was interesting, it was pretty even across all ethnicities. For some reason, Asian Americans dropped the most, 8%, huge.
All right, next topic, COVID vaccine does not cause menstrual problems.
Yeah, so I just want to be clear that this drop in birth rate wasn't because of people getting vaccinated and having fertility problems. There's so much misinformation and concern, of course, out there about the COVID vaccine. And one of the things that's been floating around for months is this idea that if you get vaccinated, it's going to mess up your periods, it's going to make them heavier, it's going to cause infertility. And now the vaccine has been around long enough that we've really actually been able to look at that. So just released this week, there was a huge study from the United Kingdom. There have been 45 million doses of vaccine administered, and what they found is that there was no increase in irregular periods, heavy periods, or infertility beyond what you would see in stressful situations. So it was the stress of getting the vaccine. I'm not saying people didn't experience this stuff, but it was the stress of the vaccine more than the vaccine itself. And the good news is whatever changes occurred, they were all temporary. So this is obviously really important because right now we have this surge in COVID, particularly in young people in that 30 to 40-year-old range, and we don't want women to avoid getting vaccinated because of concern of fertility problems.
All right, what about metabolism slowing down with age?
Yeah, this was of huge interest to me because, of course, I work with menopausal women, and we know that menopausal women gain weight, usually about 5 pounds in the first year of menopause. And while there are a lot of reasons for that, one of the reasons we've always said is, well, metabolism slows down. It happens for the men, it happens for the women. But there's a study that just came out now that they're able to really accurately measure metabolism, and no one's going to want to hear this, but it turns out that age really doesn't slow down metabolism. And they looked at all the different ages, and no surprise, the first year of life babies, they burn like crazy. They're a huge high metabolism. And then from like age 1 to age 20, it starts to slow down a little bit, but it holds steady. It holds steady from age 20 to age 60, and then it does start to drop a little bit, but not very much. We're talking about less than 1% a year. So what this means is that we have to look for other reasons, because we know people are gaining weight in their 50s. Other reasons like, okay, eat too much, drink too much, move too little. And then, of course, in my world, it has a lot to do with hot flashes and some of the other menopausal things. So this is good news, I guess. Good news for people who think that weight gain is inevitable as they get older. It is not. It's bad news for people who, have been blaming their weight gain on, well, I'm getting older and my metabolism is slowing down. It's also bad news for me because I had to just rewrite the section in my hot flash book on why women gain weight at menopause. Like it was on the way to the printer, and I just had to redo that whole thing based on this study.
All right, what about dermatologists? Twice as likely to find skin cancer if you ask for a full body check.
Yeah, this was interesting. This is a study that's coming out next month in the dermatologic literature. And we know it's not unusual for someone who has a worrisome mole or skin problem to go see the dermatologist to make sure it's not cancer. But it turns out that more than half the time when someone did have a skin cancer, it was in a different spot that brought them to the doctor in the first place. So what does this mean? Well, it means that if you go to see a dermatologist with a concerning lesion, don't just have them look at that spot. Have them do a full body check. And it's not going to happen automatically. When you make the appointment, you say, I'm coming in because there's something that I'm worried about. I want the dermatologist to take a look. But while I'm there, I would also like to have a full body check, because we're looking at 5 million skin cancers a year. And while some of them are just the less serious basal cells, this included life-threatening melanomas. So this is really important and an easy thing to do. Easy thing to do that make a big difference.
Well, thanks again, Dr. Stryker. You can follow her on social media or on her website. Have a great day.
Thank you.
Time now for Around Town.
Hey, Anna.
Okay, stand by.